Good afternoon and welcome to the Multicultural Media Online Conference hosted by the Ministry of Health, Multicultural Health Communication Service, and supported by Multicultural New South Wales. I am your moderator, Jesusa Helaratne, Deputy Director of the Multicultural Health Communication Service, and we are so pleased to have you joining us today. And this afternoon, we are going to talk about how to stay safe during the festive season. And with us, and it's really a privilege to have her with us, Dr. Jan Fizzell, who is the Acting Chief Health Officer of New South Wales Health. Dr. Jan, thank you very much for joining us.
Oh, it's so good to be back with you, Jess.
Yes, pleasure to have you. But first, I'd like to begin by acknowledging the traditional owners of the land from which we are all meeting from today. We pay respects to elders past, present, and emerging, and also acknowledge our Aboriginal colleagues who may be joining us in this session today. We also pay that respect to multicultural leaders and refugee communities who are represented in this session. Um, we are going to be talking a lot about safety during the holiday season, food, vaccination, COVID. So we'd love you to please jot down your questions, put them on the chat, and make sure that we also have a really robust and very informative session and a really good conversation today because Dr. Jan has all the answers for us. Make sure that it's only 30 minutes, but please make sure that we have all those questions with us. The Multicultural Communication Service colleagues will be putting some links to resources on the chat so that you could use them to share with your networks. Let's begin today. Dr. Jan, it is the festive season and we can feel it everywhere. Just wanted to say we're looking forward to spending time with our family and loved ones. What are the things that we should be careful of to stay safe during the season, to be healthy and really enjoy the season?
Look, I think it's really important that we do keep an eye on our health during this season. And one of the things that we can do, and I know I sound a little bit like a broken record, it's thinking about our own health before we go and be with other people. So, one of the things that we know is that COVID is gradually drifting up in our indicators. And, I know for the last two Christmases, we've had COVID come and pay us a very unwelcome Christmas Day visit. So it's really important to keep an idea of your COVID safety. And that won't just help with COVID safety. A lot of these things will also help with avoiding gastro, avoiding flu, avoiding RSV, avoiding pertussis. So the first thing is to stay up to date with your recommended immunisations. So that means that if you haven't had a COVID vaccine and you're over 75 and you haven't had a COVID vaccine in the last 6 months and you haven't had COVID, it's a really good idea to encourage not just yourself if you're older, but also encourage older members of the community to get that vaccine so that, if unfortunately, like in my household, COVID comes to visit, you're more protected. People 65 to 74 years should consider getting COVID vaccine every 12 months. And again, people who are immunosuppressed may also choose to get vaccinated again. And I do recommend it because when we're getting together, I've just noticed how exciting it is to see people in the flesh and getting together again, to think about staying home if you're sick. I know it's really hard to miss a party. I know it's really hard to miss a family event, but also giving grace to people who are unwell and making sure that you don't put undue pressure on people to turn up if they're not feeling great.
That's right, Dr. Jan. Sometimes people feel like if they don't go, the host will be upset.
Exactly. And I think it's really important to give grace to, just be kind to people and say, look, if you're not feeling great, it's okay if you don't come. And organizing, a video call with that person so that they don't miss out, or, organizing when Santa comes to open the presents, or whatever your family festivity may be over this season, making sure that we've got so many ways to participate, and bringing some of those things that we were doing COVID back to include everyone, but making sure that people don't feel like they have to go and visit grandma, and also remembering that Christmas is a season, not just a day. I think we put a lot of emphasis on being together on a particular day. If you can, waiting a couple of days till everyone's well enough to be together is such a great way of including people and making sure that you're all making memories together. So again, giving yourself grace to sort of say, I'm just going to wait a couple of days and we'll get together, or we'll do it as a progressive visit. There's lots of ways we can spend Christmas or this holiday time together. It just might not be all on the same day if someone's not well.
That's right. And like you said, it is about bringing all those habits that we've learned.
Yeah. And so getting together outdoors, as I said, we've had COVID come and visit us a couple of times at my house. And, the really good thing is we actually haven't had any transmission, because what we did do was we were outdoors. And so when we found out afterwards someone wasn't so great, we didn't actually have people getting infected. So I'm not saying we're perfect. We are not a perfect family. Anyone who knows my family will, happily say that. But just saying that there are the things that we do sometimes. And so, this year my family's talking about we'll have a picnic outdoors, because that way, we've got the nice outdoors, because hasn't the weather been lovely apart from too hot, too much rain, too much. Anyway, but when the weather's lovely, it's really great to be outdoors. But also making sure that you've got a plan over this coming time, because we know that if you are immunosuppressed or if you're older, having that plan to get those medications, if you are sick with COVID over that Christmas, New Year period, can be difficult. So talking to your GP now to have that plan, who am I going to call? How will I be in touch? Will be really important, but also using that Health Direct number anytime over the Christmas season for any health issues that you've got and you just want some advice and you don't think you're going to be able to get into your GP, or even the pharmacy's closed, do ring Health Direct. They've got people online to talk to you on the phone, and you can use the telephone interpreting service, of course, to get through to that number and have some advice. The other thing that we've got in certain areas of New South Wales is we've just found the mozzies have got JEV again. And so making sure that you're doing good, you're meeting outdoors, but make sure you've got mozzie repellent on, so that and also wearing long sleeve light clothing. That tends to keep the mozzies away. So that if you're one of those poor people who is a mozzie magnet, like some members of my family are, I'm really happy when I go out with them. The mozzies get them instead of me. But trying to make sure that they've got appropriate repellent and that they're protected is really important.
And also trying to see if you can get that vaccine if you're in their areas.
Absolutely. So that JEV vaccine's available through pharmacies and GPs if you're in one of the local government areas, or if you work outdoors, or if you're going camping for an extended period of time over the holidays in one of those regional areas, you can get the vaccine.
Yes, so if you have any questions for Dr. Jan, please just add them into the chat and we'll try to get them answered for you. Now, Dr. Jan, when you said about the weather, it is fantastic, but then mozzies are around.
Yeah.
So we always think that if it's hot, then we wear short sleeves.
And I think that's a really hard thing to get your head around, is wearing long sleeves. But I mean, there's such lovely light clothing now that you can do. And it's so much easier to avoid a mozzie bite than have one of, like if you've got one of those, poor kids who, just come up all over if the mozzies get them. It's much easier just to put them in some light clothing and help protect them rather than having them bitten. And same with older people, or as I say, any adult. We've got mozzies, they've got diseases. It's better not to be bitten. So taking precautions both here and if you travel overseas, of course, there are some really interesting viruses that mosquitoes carry overseas. So again, being really aware when mosquitoes are active and wearing that light long sleeve clothing, really helpful.
You talked about being overseas, but if you are in Sydney or in New South Wales and during the holiday and you do feel unwell and it's public holiday, you could call Health Direct.
I think that's the thing. So basically, it's not just about COVID. It's not just about gastro. It's about any health condition you're concerned about. If it's an emergency because you're having trouble breathing or you've witnessed something really horrific, definitely 000. But Health Direct can help you with everything else, and they're absolutely fantastic service. Again, it's a free call, and again you can use the translating interpreting service TIS National to help you get in touch with Health Direct to have that conversation, and they can help you, put you in touch even with some of our urgent care services, which will be open across the holiday period if that's the appropriate place for you to be. They can put you in touch with some of the virtual care services, so they're really helping us provide a comprehensive service to people in New South Wales. But of course, the other thing is, we've got a couple of weeks before, Christmas and thinking about making sure that you've got your medicines that you'll need for that period and all of those things. Just getting yourself prepared for that period of time, usually between Christmas Eve and New Year's Day, when a lot of services are less available.
And in calling Health Direct, you're guaranteed to be speaking to a clinician, isn't that
That's
right?
correct. They're registered nurses who are particularly trained to take these types of calls, and they can then escalate those calls to other people or get somebody else to call you back pretty promptly if it's one of those types of calls where they think that a virtual service will help you. But I was just going to say though, but just remember if it is an emergency, so chest pain or pressure more than 10 minutes, difficulty breathing, somebody's bleeding uncontrollably, somebody's, collapsed, or, you've seen somebody and you think they may have had an overdose, because we do know it is Christmas season. Some people do party. And sometimes, with some of the uh, drugs that are circulating in the community for use at parties. We do know that we've got more and more people at risk of overdose because people think they're using cocaine. It's actually got a different drug in it. So don't be afraid to call an ambulance if somebody's in that condition, because we will look after them and stay with them. You're not going to be in trouble. We're going to, the ambulance is there. We're health services. We're there to provide health care.
And I think that's best information, Dr. Jan. It's a lot of people are worried if they don't call doctors or emergency, they might get in trouble. At the end of the day, it is about the health of the person.
That's absolutely right. And, you may have heard of the nitazines that are coming into circulation in New South Wales. We've had people thinking that they're taking a tablet and they think they're taking one thing and it turns out to be something else. Again, people taking cocaine think they're taking cocaine, it turns out to be something else. And so the effects won't be what people expect. And again, with some of the party drugs people take, again, hot weather can, make something that would sometimes for some people be a pleasurable event turn into a dangerous event. So being really aware of what you're doing and talking to peer support and other groups to help you understand the risks that you might be taking if that's what you choose to do.
Dr. Jan, holidays. Now, we talked about being in New South Wales in Australia, but when you do go on holiday, this is crucial because you're away from your usual doctor, from your usual environment. So there are things that we need to prepare for.
Absolutely. So the first thing is to know your destination and know what's going on with health risks in those areas. We know some countries have got measles outbreaks, some countries have had pertussis. Things are going on in different countries and different levels of healthcare are available. So the Smart Traveller website has health information available to you and will help guide you towards any immunisations you probably should be having now if you're planning a summer break, so that you're protected against things like hepatitis A or cholera and other things that you can be vaccinated against. So talk to your doctor or your pharmacist, because pharmacists in New South Wales can do a lot of the travel vaccinations for you, about what you might need to think about, and also any over-the-counter type medications you might want to take with you from the pharmacy that can be more difficult to access overseas. So things like paracetamol for headaches, things like things to deal with gastro type symptoms, like rehydration tablets that are easy to take with you, or things to help you if you've got diarrhea. It's important that you have your flu vaccine, because whilst it's not flu season here, it is flu vaccine overseas. So talk to your chemist or your GP about the availability of flu vaccine, and do think about that, because catching flu while you're overseas is just unpleasant. Same with COVID. Don't want to catch COVID if you're overseas. Make sure that you've got enough medication for where you're traveling, and also think about if there are any restrictions, because, for example, codeine containing medicines can be quite lawful here in Australia, but you can go to other countries and they may not be lawful. So make sure you've also got a doctor's letter with you. And if you're in any doubt, contact the embassy of the country that you're traveling to, and they should be able to provide you advice. Make sure you take your own first aid supplies with you. Again, it can be really difficult finding things that you think are simple and freely available here in Australia, and they're not so much overseas. Things like mosquito repellent sunscreen, hand sanitizer, and as I said before, the oral rehydration products. You don't have to take the bottle of fluid. You can get them in tablet form that are really good, and you just throw them in your bottle of drink, and there you go. But also really, really important, I can't emphasize this enough, is if you can't afford travel insurance, you cannot afford to travel. You need travel insurance. And if you've got a pre-existing condition, please make sure you talk to your insurer about the type of cover that you could expect for that pre-existing condition.
Now, Dr. Jan, you talked about immunization and vaccination. How long before you travel should you be planning your influenza or your vaccines?
Look, it's never too late, I
Mm.
think is the first thing to say, but we can get a better response if we've given our immune system a bit of time to rev up. So I think the key answer is it's not too late, because especially most of us don't go away for like a weekend. Most of us go away for a week or two. So it's never too late. But if you're going to travel and you're going to travel over this December, January period, now is the right time to be being vaccinated. But if you haven't been able to fit it in, everything's gone, it's been that end of year chaos. It's not too late. Please talk to your pharmacist, talk to your GP about being vaccinated.
Now, Dr. Jan, I had paracetamol in every bag I had, just in case. So
Yep.
it was in my luggage, it was in my traveler's bag, and also my handbag,
Yep.
just in case.
Yep.
And I thought I was never going to have problems with food, but you never know the reaction. So I actually made sure I had that antihistamine, and it was great, because if I didn't had it, I could have had more problems.
I've been traveling in Europe and, wanting to get something that's available very easily in a supermarket here in Australia, and having to find a pharmacy that was open to be able to help me in Europe. So, it doesn't mean that just because you're not going to an English, you're going to a Western country, you can still have medicines that have very different regulations around their availability. So if there's something that you use over the counter here, like an antihistamine or a nasal spray, make sure you've got your asthma medication with you, definitely. And if you're one of those people that infrequently gets asthma, check that your puffer's still in date, because that's a trick. And making sure that your things are all in date, that everything's ready. And that way, if you keep them all together, so that if you've got a customs inspection, if you can, keep them in the box that you purchased them in. And that way, it's very obvious where they've come from, what they are. And that way, people won't have any questions. Because if you have a bottle of unnamed white tablets, it may be slightly more difficult.
And you also mentioned about hydration,
Yep.
because that's really important. You can have them in little tablets, cubes.
Well, that's the thing, like in my family, we get these tube things. They're not particularly expensive, and they come with us everywhere. And that way, if someone's crook, we've always got something that is palatable. We make sure that we make it up with the appropriately treated water. So it's either bottled water, or we also have a little UV pen that can sterilize water where we go places. Other people may use chlorine tablets, and sometimes kids don't like the taste of the chlorine in the water, and that's the aquatabs. And if that's what you're using to purify water while you travel, do think about taking something that will make it slightly more palatable for your kids. And those tablets sometimes do that same thing of, keeping the kids hydrated. Not that you need special tablets to keep kids hydrated, but it can also mask the taste if you've had to treat the water in one way or another.
And it's just like you said, really investigate the places you're visiting.
That's it. And so it's things like, understanding whether it's safe to wash your fruit and veg, for example, in the water out of the tap, or even safe to clean your teeth. I think I made that fatal mistake once when traveling overseas, and cleaned my teeth with the tap water. And believe me, you don't want to make that mistake.
Yes, can imagine. It is hard to make, and that's
it's
just
hard to be vigilant, because there's things that we just do as a matter of routine. And so it's just, being aware, and also not overcomplicating things, because lots of places have really excellent tap water, and you don't need to overcomplicate it. Use the tap water, drink the tap water, refill your bottles, so that you're not, causing more problems with the planet. But be really aware where you are and what you're doing, and the fact that you can change. If we move and change between countries, the place that we transit through may be the place that doesn't have the safe tap water, but the place that our destination does.
Well, I want to ask you, Dr. Jan, when you're traveling on the plane, it's different. Your body also changes, and socks, the right footwear.
That's right. And I think that's one of the things that we know that for some people, sitting immobile for a long period of time, really not a good idea. So making sure that you do move and do move your legs around, that you stay hydrated. Drinking a lot of booze on the plane really isn't really all that helpful. I know a lot of people, if they're very anxious about it, go and talk to your GP about anxiety on planes before, because a lot of alcohol consumption, you won't necessarily feel great when you get the other way. And also being really aware of just time zones, and again, giving yourself enough time to adjust before you throw yourself into something in a new place, new location, because it can be as simple as making sure you know which way to look when you're crossing the street. You're tired, you're in a new place and you've looked the wrong way, it's not good.
So thank you very much for that, because it is getting to your destination,
Yep.
but also where you are,
Yeah.
what you have to prepare for, but
And it
also
can
when
be a
you're traveling.
completely safe and appropriate destination, which is 100% safe. It's just that if you're the fish out of water, or even a little bit of a fish out of water, you can make those mistakes, like looking the wrong way. And it's just being really aware of the changes.
Yes, and then you did mention about we talked about mosquitoes, but there could be fire and all the weather could change as well.
Yeah. So, I mean, we always know that summer's a particularly interesting time to be an Australian, because we tend to have those fierce storms that we've seen, and we can also have fires. So, if we do have fire and you notice that there's smoke around, if you've got asthma, if you've got other health conditions that like heart disease or other things, please stay inside. Listen to any of the air pollution warnings, and you can actually get an air pollution warning on your phone through one of the apps. Similarly, if it's the very hot weather, please be really careful. Keep an eye on older people. Make sure you're talking to them. Make sure that they're okay, because it's often a series of hot days and hot nights together that can cause people problems. So, if you have got older people in your family and they don't have air conditioning, and you're lucky enough to, offer to put them up at your place, so that they've got that cooler environment, because older people's bodies don't adjust so well to the heat. As same with young infants, being really careful with young infants in the heat. So being really, really careful about older people and young kids.
And you did mention about checking in with the people, maybe neighbors as well.
That's right. So, we've all got a community, and we've all got a community, hopefully we've all got a community that has people of all ages in it. So making sure that you've got someone just to check on older people who, live nearby, who, you normally would wave to your neighbour over the fence if you haven't seen them for a day or so. Just knock on the door and just check that all's okay with them.
Dr. Jan, in terms of you said about the mosquitoes and then the fire, where should you go? What is available for the community out there?
Yeah, so look, New South Wales Health will always put out alerts if there's issues around the quality of the air, as well as alerts through Facebook and other areas. So keep an eye on the New South Wales Health website and our social media. We do tend to put up things. We have fact sheets about all of this information, and often translated into many different languages. So please go to our website, have a look. There'll be information there about staying safe in the heat, staying safe if there's bushfire. For people with asthma, being aware of the need to make sure you've got an asthma management plan at this time of year, because we do know that with thunderstorms, some people can have their asthma provoked and quite severely. And what we know is it's the people who actually haven't had their asthma for a while who can be severely affected. So again, if you've had asthma in the past, making sure that you've got, medication that's in date, and you keep it with you if it's storm season. We see these thunderstorm warnings coming through, making sure that you've just got your reliever medication with you if you're not routinely on a preventer.
And the resources are available in New South Wales Health website and also on the Multicultural Health Communication Service website for health workers and communities as well. One of the things that people also get caught up with is the food, and
Yes.
food safety is really key. I mean, when I was back, I went traveled to the Philippines. You know, the food, different way of storing food, and that depends on the climate.
It really does. And with the hot, humid weather here in New South Wales, it's really easy for food to go from really safe and delicious to really unsafe and still delicious, which is the problem.
That's right.
And so that's one of the issues that we really need to be really mindful of because, we do tend to graze, I think, a lot over the festive season. So the really important thing is once something's cold, keep it cold. Make sure that if it's a food that will go off, that you put it in the fridge between grazing sessions rather than just leaving something out for a number of hours. Make sure that it's clean, make sure that people are, keeping their hands clean. So that whole wash your hands before you come to the table thing is still very important. And if you're out and about, then take some hand sanitizer with you. Making sure that you have, your utensils and that people aren't sort of passing things spoon to spoon to spoon to people. And if you've got hot food, keep it hot until you're putting it away and then put it in the fridge once it's cool to room temperature or, because if you've had something sitting out for more than 2 hours, it's not safe anymore. So, preserve that really fantastic leftover ham, turkey, or whatever your family's preferred, festive food is. But don't leave hot foods out for more than 2 hours, which can pass really fast when you're having a family to you do. So think really carefully about putting things away quickly and, as I say, get them out again when you want to and heat them up properly rather than, leaving something out. And as I say, going from safe and delicious to unsafe, but still delicious.
Yeah. And a lot of people are celebrating a lot of end of year celebrations plus New Year cultural events. Some may not be celebrating Christmas, but they're celebrating other festivals. And this is the common denominator is food.
Yes, absolutely. And I think that's the thing. We're so fortunate here in Australia to have so many different types of foods available to us, so many different ways of eating, so many different ways of sharing with each other. So thinking carefully about transferring things, that are hot, keeping them hot, transferring things that if you've got some leftovers and you're sharing with your neighbors or your friends, which I know I've been really privileged to have at times, making sure that you've kept them cold and that the people that you're giving them to know to keep them cold until they're heating them up. It's really important.
There's some also who aside from food, there is that alcohol, and
Absolutely.
healthy consumption is important.
And I think that's the thing. We know that it's one of those times of year where people can overindulge because there's lots of parties, and so being really aware of both the effects on your short-term health and your long-term effects on your health, and the fact that it can be really expensive and can really pile up the expenses. And we've all seen people get disinhibited and have unfortunate arguments with friends, family, colleagues. So, being really aware that it can have that negative impact on you. So, really having a good strategy about how you deal with alcohol at parties and at celebrations is really important. So, thinking really carefully about what you're consuming so that if rather than having people topping up glasses all the time, so that you can understand what's actually going into yourself, checking in with yourself. And, if you've completed a drink, how am I going? How am I feeling? Am I still safe? Alternate those alcoholic drinks with water so that you're actually staying hydrated, which is also really important. Don't drink on an empty stomach. I can't imagine how many times my mum told me that, but it's still good sound advice. I actually don't think my mum told me to drink, to be perfectly honest, but other people's mums have given them very sound advice. Thinking really careful about how you can talk to people about the fact that you don't drink. I don't drink very much, and so I do actually have to say no, thanks. I understand it's delicious, but not for me right at the moment. So practicing that, and the more you say it, it actually gets much easier to say. It's really important that it's not about judging anyone else. I really don't mind who else has a drink. It's just that it's not for me, and so that's what I say to people. And knowing your triggers, that some people, alcohol, people can self-medicate with it really, and understanding whatever it is that you're thinking alcohol is solving, if you're having one of those moments, find a different, think about it before you get to that moment. For me, this Christmas could be fairly sad. I've lost some really dear people in my life, so I'm going to know that they're not there. And so thinking about that before, what are my strategies going to be if those are happening, rather than, turning to maladaptive things, working it through, talking to my family about where I'm going to need support. So, we've already talked as a family about how this Christmas is going to be different, and talk to each other about what we're going to do, with it being different. And so if you've had a bereavement, or if something that, is really precious to you isn't happening this year, talking through people and seeking support before it actually happens, really important.
Now, we have a question here. Dr. Jan, do you have any advice on managing jet lags?
Oh, jet lag. Oh, jet lag. Apart from not traveling. No, look, I think the really important thing with jet lag is being really aware when you're flying about staying hydrated, so that you've got that, moving to the new sleep schedule as quickly as you can. If you're traveling with kids, just be ready to have a really hard time. And so not scheduling really important things on that sort of first couple of days when you arrive, and being kind to yourself, and being ready to sort of take an afternoon nap, but then wake yourself up in the evening and go and do something, and then get back to bed tired. But it's hard. Some people find that some over-the-counter medicines can help them, so they can talk to their pharmacist about that. Some people find other medicines may help. Talk to your GP about that in your particular own circumstance. I think the key things, from my understanding, stay hydrated, try and get onto your new sleep pattern as quickly as possible, and if at all possible, do not schedule something that you really need to be awake and really enjoying in that first day or two, particularly if it's a big time zone change.
And also, this is deep vein thrombosis where your feet when you're traveling.
Yeah, so with DVT, so that's clots in your legs that can form because we're not moving around as much. It doesn't happen all the time. Key things are to make sure that you are mobilizing those ankles and getting up for little walks up and down the plane. I know it can feel really difficult if you're stuck in the middle seat and have to pole vault over people, but trying really hard to make sure that, you're moving your legs up and down, that you're going for those little walks up and down the thing, and really staying hydrated stays important. If you're a person at higher risk of DVT because you've had one in the past, or you've got a strong family history of a clotting disorder that makes you at higher risk, then please talk to your GP before you travel to get the best advice for you.
Well, I traveled 8 hours yesterday, and long. It's not such a long flight than going to Europe, but you
Still a
could,
long
yeah, it's
flight.
still a long flight, and you have to walk around, and that's what I remembered.
Still remember one of my saddest cases of DVT, and this was a Christmas DVT, was a really lovely grandpa who'd sat and played PlayStation with his grandkids for a number of hours and hadn't really moved. And the next day, sure enough, he had a very sore leg, and yeah, he'd had a DVT because he basically just sat there playing. So yeah,
These are things that we have to be.
that's right. So,
careful of.
it's one of the reasons why we suggest that if you're working, whatever you're doing, just take that break, stand up and walk around. Because, it can be that you've got something going on that you wouldn't know about. But yeah, those 8 hours, a long time to be sitting in one, we don't sleep in one position for 8 hours, we move. It's not a normal thing for us to be stock still for 8 hours. So that's why it's a good idea to get up. Or if you can't get up and you're feeling really shy and you don't want to do the pole vault things, I know I really hate doing that. Doing that thing where you're trying really hard just to walk up and down the plane or move your legs around, really important.
Well, we've run out of time. We can talk forever with Dr. Jan, but we have run out of time. Thank you for your questions. And the all the information is on the chat. Dr. Jan, any last words?
I really hope everyone has a really safe and healthy festive season, that you really enjoy any time you have. And if you're one of the people who's working really hard to keep the rest of us safe or moving or fed, I hope that you still get time to look after yourself and have a great, great end of year.
Thank you so much, Dr. Jan. And thank you for being with us this past 2024. This year, we've had so many sessions. This is the last session we have for this year. We will see you in 2025. The recording of this session will be available on New South Wales Multicultural Health Communication Service website. We'll send this through email with links to the information to keep safe and healthy during the festive season. And for those celebrating, please make sure that you stay safe. Remember all the tips and advice from Dr. Jan, but also remember that some people may be feeling a bit sad this season, and to reach out to them when you can. So we want you to stay safe, take care, call Health Direct if you need it. For the meantime, from the New South Wales Multicultural Health Communication Service, from the Ministry of Health and Multicultural New South Wales, and all the agencies across New South Wales Health, we thank you. Stay safe, take care, and we'll see you in 2025.